Dr. Burke here. And listen, today's topic might literally predict how long you live. I'm not exaggerating. Let me hit you with a question right away. Have you ever felt your legs getting weaker, slower, heavier, or just not the same as before? If yes, this video is exactly for you. Strengthening your legs isn't just about looking good in shorts, it's about survival, longevity, and the early warning signals your body sends before something serious happens. Your legs are like an alarm system. They warn you of diabetes, heart problems, circulation collapse, hidden nerve damage, and aging long before you feel it anywhere else. So buckle in and keep watching, because what you learn today might literally add years to your life. First up, peripheral neuropathy. This is a huge early warning sign, most commonly linked with diabetes. High sugar in your blood destroys two things, your nerves and your vascular system. And why does it hit the feet first? Because these nerves are the farthest from your heart. They get less oxygen, fewer nutrients, and less blood flow. The result is tingling, burning, numbness, or pain. Now, let me ask you, do your feet ever feel numb? Do you get that pins on needles sensation? Do they burn? If you said yes, don't ignore it. Your body is practically yelling at you that your blood sugar is out of control. Here's the shocking part. You only need about 2 teaspoons of sugar in your entire blood volume to be considered diabetic. That's it, just 2. Yet, the average person consumes 50 to 100 teaspoons daily, including hidden sugars in carbohydrates. Your body is constantly working overtime, using insulin to vacuum up this excess sugar, until eventually your insulin response just burns out. So remember, peripheral neuropathy is not a foot problem. It's a blood sugar disaster that shows up in your feet first. Next, let's talk about ankle and foot edema, the puffy leg warning. You've probably seen people with huge swollen feet. Maybe you've taken off your socks and noticed deep marks indented into your skin. That's called pitting edema, and it's a serious warning. If fluid is pooling in your lower legs, it can mean several things. The heart might be struggling to pump effectively, your kidneys could be under stress, there might be impaired circulation in your liver. Essentially, blood isn't returning to the heart properly. So, ask yourself this: do your ankles swell up by the end of the day? If you press on the skin, does it leave a dent that stays for a few seconds? If the answer is yes, your lower leg is being suffocated by low oxygen, and your heart is fighting an uphill battle. This isn't something to just brush off. It's your body screaming. Circulation is failing. Third on our list is restless leg syndrome, the nighttime torture. Have you ever tried to sleep while your legs feel like they want to run a marathon? I've had this, and it is maddening. It's usually caused by things like excess sugar, alcohol, a diet high in starch, or deficiencies in B1 and magnesium. Too much sugar leads to too much lactic acid, which irritates your nerves, causing twitching and cramping. Now, if your legs are keeping you awake, guess what else is happening? Your cortisol levels are higher. Your risk of diabetes and heart attack goes up. Your longevity gets destroyed. So, think about this. Do your legs ever jump, twitch, or have a crawling sensation at night? If yes, you're not getting real sleep. And if you're not sleeping, you're aging much faster. The fix? Cut out sugar and refined carbs. Supplement with vitamin B1, specifically benfotiamine, and add magnesium to your routine. These 2 nutrients alone can often flip the switch on restless legs. Now for something very serious: deep vein thrombosis, or DVT. This is when a dangerous blood clot forms in the deep veins of your legs. If that clot breaks loose, it can travel to your lungs, and that's often game over. And what causes these clots? Sitting for too long, chronic stress, a high-carb diet, and poor circulation. Here's a scary fact. Over 90% of heart attacks and strokes are uncaused by plaque buildup, but by clots. This is why the health of your legs matters so much more than most people think. Next, let's discuss peripheral artery disease, or PAD. This refers to artery damage that happens outside of the heart, especially in the legs. The inner lining of your arteries, called the endothelial layer, is supposed to be slippery. When it gets damaged by high sugar, your arteries stiffen, blood flow decreases, plaque starts to form, and clots can develop. And once again, the legs get hit first. Do your legs cramp up when you walk? Do your calves feel tight and sore after just a short distance? That's an early sign of PAD, and it predicts future heart events with terrifying accuracy. Let's move on to chronic venous insufficiency. This is when you have stagnant blood pooling in your legs. If you're sitting for most of the day, the veins in your legs can't effectively pump blood back up to your heart. The signs include thick, brown patches of skin on your lower legs, visible varicose veins, hair loss on your legs, thin and shiny skin, and that pitting edema we talked about earlier. All of these signs point to one thing. The lower legs are slowly suffocating from a lack of oxygen. You must move your calf muscles. Think of them as your second heart. This brings me to sarcopenia, which is age-related muscle loss. This is one of the biggest predictors of early mortality. Lose muscle, you lose lifespan. It really is that simple. Your legs contain the largest muscles in your body. They are crucial for burning sugar, maintaining your mitochondria, stabilizing your joints, and supporting your entire body weight. You must eat enough protein, lift weights, stay active, and actively work to maintain your strength. Ask yourself, are my legs getting thinner, weaker, or softer? That's sarcopenia knocking on your door, possibly much earlier than you think. But you might have noticed a common theme here. Type 2 diabetes is the root cause of at least half of these leg problems. But here's the good news. You can reverse type 2 diabetes often in as little as 10 weeks. How? By adopting a low-carb diet, practicing intermittent fasting, and completely removing processed carbohydrates from your life. Doctors typically manage diabetes. They rarely reverse it. But you can, for neuropathy specifically, taking benfotiamine, which is a fat-soluble form of B1 4 times a day, along with alpha-lipoic acid, can help rebuild the damaged nerves in your feet and fingers. So, what's a simple, powerful action you can take right now? Let me introduce you to the soleus push-up. This one simple exercise can dramatically improve your circulation, reduce leg swelling, lower your blood sugar, and reduce the stress on your heart. Here's how you do it. Sit on a chair with your feet flat on the floor. Keep your thighs relaxed. Then, simply lift your heels up, straightening your ankle, and then lower them back down. Do this slowly and steadily. The soleus muscle in your calf is unique. It almost never gets tired, and it powerfully pumps blood back up toward your heart. If you have a desk job or sit a lot, do this exercise every 10 to 15 minutes. Your legs will thank you. Let's bring this all together. Your legs aren't just for walking. They are a health dashboard, a critical warning system, and a longevity meter. If your legs are weak, your future is weak. But if you strengthen them, you strengthen your entire life. So ask yourself, are my legs aging faster than the rest of me? Or am I going to take action today? Because every step you take, every rep you do in the gym, every bit of sugar you avoid is a vote for the future you want to live in. Take care of your legs, and they will take care of your lifespan. Thanks for watching, and don't forget to subscribe for more tips to help you live a longer, healthier life.